So we can just wait to see when Rick joins.
Also, I can confirm that it says that I can pause or stop the recording. I don't know, Joanna, do you see the same thing in the bottom?
Yeah, we can see that. I think we can record it.
Yeah, so we are recording now.
Now, or let's record a little later.
Should I pause?
Yeah,
hold on a second, I'm logging in.
Your participation, because you had to change the last minute, the platform in last minute to accommodate as many more colleagues into this discussion forum. Sorry for that last minute change. So we'll have 90 minutes for our discussion. The first 45 minutes will be presenting and sharing lessons from partners, and remaining 45 minutes will be for the thematic discussion. So at this stage, I would like to, without further ado, I would like to invite my colleagues, Mrs. Oren from Global Handwashing Partnership, to moderate the first part of the session. Over to you, Oren.
Great, thanks, Sam, and I hope everyone can hear me okay. So just to get us started, I want to give a bit of housekeeping. So this session will be recorded and a recording will be available once the webinar has ended. You'll also see both a chat and Q&A feature at the bottom of your screen, and these will allow you to interact with other participants and the panelists. So on the chat feature, please be sure to select all panelists and attendees so that everyone can see. And if you do have questions, please be sure to use the Q&A feature at the bottom of your screen so that we can more easily identify your questions. We will have some time for Q&A at the end of all of the presentations, but if we do not get to your question, we will be collecting them and sending out a report once the session has ended. So with that being said, we do have a lot that we want to accomplish for this session, and so I'd like to introduce our first speaker, Ms. Joanna Estevez-Mills, who serves as the Hand Hygiene for All Global Coordinator with WHO and UNICEF.
Hi, everyone. I'm also coordinating the slides, so I'm finding it a bit tricky, but welcome everyone, and thank you very much for the introduction, Aaron. It's a real pleasure to be here today and to share with you some information on the Hand Hygiene for All initiative, which hopefully many of you will already have heard about. So the Hand Hygiene for All initiative is a call to action to scale up hand hygiene across the whole of society, and it also seeks to provide a global framework for coordinating action and for aligning it behind country efforts. And before I go much more into detail on the initiative, I just wanted to spend 30 seconds situating the initiative within the global context for hand hygiene, which I would imagine for those of you joining the call is unnecessary, but still. So hand hygiene is the first defense against COVID-19 and one of the most cost-effective ways to protect global health. It's also a human right and is fundamental to human dignity. And yet, as many of you on this call will know, for many people it still remains out of reach. I'm not going to read all of those statistics there on the left-hand column, but they come from the Joint Monitoring Programme for Water Supply and Sanitation and Hygiene. And I would encourage you to have a look at the website if you haven't done so already. But you know, shocking 40% of the world's population don't have a place in their homes to wash their hands with water and soap. And this is really largely targeting the most vulnerable in society. And for example, across different settings, you know, for example, nearly half of all schools don't have hand washing facilities with water and soap. The situation in healthcare facilities is also suboptimal, and we're finding more and more out about other settings as a part of this initiative. Also on the right-hand column, just to flag that financing and monitoring remain inadequate. And my colleague Sophia Murad will be speaking more about this in the following presentation, so I will move on for now. So the response, the Hand Hygiene for All initiative aims to bring together international partners, national governments, public and private sectors, and civil society across multiple settings to ensure affordable products and services are available, especially in disadvantaged areas, and to enable a culture of hand hygiene. really the aim is to support the development of country roadmaps that bridge together national COVID-19 preparedness and response plans with mid and long-term national development plans to ensure that hand hygiene is a mainstay in government programs within and beyond this pandemic. And what the global initiative seeks to do is to create, as I've said, a common platform to coordinate voices and drive collective action, and very much to align these behind national hand hygiene strategies. And just on the left-hand side there, I've linked to a number of documents which may be of interest, just to flag really that this initiative doesn't exist in a vacuum, and it draws on several other initiatives from WHO and UN Water and UNICEF, in particular the WHO interim recommendations for obligatory hand hygiene against transmission of COVID-19. So just this slide really just seeks to illustrate what I've just described, in the sense that the country roadmaps and country action really are at the centre of the initiative. And that underneath there you can see these 5 accelerators seeking to support the activity at the country level. And just to flag that these 5 accelerators map onto the SDG 6 Global Acceleration Framework. 5 accelerators as well. So it's really seeking to operationalize that global acceleration framework, specifically with regards to hand hygiene. Here, I've just inserted a theory of change, which you can look at your leisure when the slides are shared, and really just reiterates what I've described, but flags again at the country level outputs. So just here, that there are 3 main pillars that we think underpin success. The first is political leadership. The second is ensuring a strong enabling environment. And the third is ensuring robust supply and demand. And at your leisure, you can see the building blocks underneath here that we hope will achieve this at the country level, and the global level accelerators that I've described that sit underneath that. So I'm running out of time, so very quickly, this is my last slide, just to flag that this isn't, really this is a platform that we hope to drive collective action through, and that there are 4 main categories of actors. So WHO and UNICEF are leading this initiative, and obviously a key actor is low and middle income country governments, but also we have 10 or so core partners at present who have signed up to really committing resources and activities to this initiative. And then of course the broad swathe of supporting stakeholders. And I just wanted to flag as well in this slide that the links with other existing initiatives at the global level. So the Save Lives, Clean Your Hands campaign, the call to action issued by SWA, also the Water Action Decade, as I've mentioned, SDG 6 Global Acceleration Framework, and Safe Hands. And I'll stop there. Thank you.
Yeah, and I think that was a great overview of the Hand Hygiene for All initiative. Again, I think it's great to see that initiative linking the COVID-19 response efforts to a longer term impact. Next up, we have Ms. Sophia Murad, who serves as a technical officer at the WHO, and she'll be presenting a snapshot of the latest UN GLAAS findings. Sophia, up to you.
Thanks, Erin. Hi, everyone, and welcome. I'm really glad that we could join you and be a part of this webinar today. As Joanna mentioned, I just wanted to run through a few of these kind of underlying statistics and data and information that we have regarding the enabling environment and wash systems and what systems are in place to support hygiene. So with that, next slide, please. Thank you. One thing that we're finding from the latest GLAAS cycle, where we collected data from 114 countries, is that the majority of countries have said that they have policies and plans in place for hygiene. But one of the more concerning aspects of this is that in order to implement these plans, only 9% of countries say that they have sufficient financing to properly implement the plans for hygiene that they have in place. So I think in terms of the enabling environment and these larger systems in play, this is one area that definitely could be worked on in terms of improvement. Next slide, please. Thank you. Another thing that we have seen is that in terms of kind of political will and these kind of key good indicators of political will is that countries are putting in place national targets for basic hygiene. And that's to say coverage targets that aim for hand washing facilities on premises with soap and water. So about 41% of countries that we surveyed reported that they have a basic hygiene coverage target. But more alarmingly is that not very many countries have these monitoring systems in place to necessarily track the coverage of their own national targets. So what we're seeing here on this figure is the blue dot is showing countries that could report the progress to date, and the orange dot is what their national coverage target for basic hygiene is aiming for. So you'll see many countries have this 2030 deadline. Others have little interim targets that they have in place for achieving basic hygiene coverage. But there's definitely some monitoring gaps, and we're looking to improve that through the Hand Hygiene for All initiative. Next slide, please. Thank you. So to follow up, you know, there's really this struggle with financial resources, especially in hygiene. Part of it comes from it being very difficult to measure what resources are going specifically to hygiene, as often it's, as we know, linked with sanitation or water or other sectors. But we did survey to ask countries how they see the sufficiency of financial resources in order to reach these targets that they reported. And what we see is that only 4% of countries really stated that they have sufficient funding, which in this case means that they only have more than 75% of what is needed to reach their national hygiene targets. So definitely this is an area of work that we're hoping to improve, and we're hoping that in general that the monitoring of this area can improve and lead to, you know, these stronger systems and stronger initiatives to get resources where they're needed in the hygiene sector. Next slide, please. And that's all from me. There is more of this information that can be found and more of these findings in this hygiene highlight, and it'll be available on the slides, and I can share the link to some of these reports in the chat. Thanks.
Thanks, Sophia. Yeah, really great overview of the latest UN GLAAS findings as well. Up next, we have Dr. Amprasad Gautam, who serves as the global lead for hygiene behavior change at WaterAid UK, and he'll be presenting on the programmatic response that WaterAid is doing.
Thank you very much. Hi, everyone again. In March, WaterAid has decided particularly to respond COVID-19, focusing on WAS, in particular positioning hygiene behavior change, one of the first line of defense to COVID-19. Next slide, Joe. So why hygiene is a primary focus for COVID-19? Because of course, due to lack of vaccines, lack of medicine, WaterAid as an institution focusing on water sanitation and hygiene historically, there are lots of other mechanisms through which you can actually suppress the virus. But WaterAid really would like to focus on the WAS intervention, particularly focusing on behavior change. Therefore, institutionally, we have decided to implement our response to COVID-19 in March, focusing on 26 countries where we are operating it. Within those 26 countries, we started implementing 12 large-scale behavior change programs in countries. We are trying to reach 99 million in those 12 large countries, and we have set up ourselves that this is a 12-month response, and we will be targeting multiple settings for the response, particularly community settings, the schools, care facilities, public places, and institutions. When it comes to behavior, we are prioritizing 5 key hygiene behaviors, including hand washing with soap, face coverage is a mask, the cleanliness, surface, physical distancing. We actually use a behavior-centered design approach in order to implement evaluate our in ABCD process wasn't feasible, informative research, and going through a robust creative process is actually taking time. So therefore, we actually tweaked our approach to make it very light. At the same time, we actually use a phased response, focusing on do no harm approach. Do no harm approach meaning any of our hygiene promotion, we didn't want it to expose any of the people for cross-transmitting the virus. So we actually have analyzed the context, we define the design principle, then we commission a creative process to design the hygiene intervention package in each of those countries. And currently we are delivering, particularly focusing on mass media, digital and social media, and non-contact methods, because any contact methods will have the opportunistic positioning for virus to transmit from one to other. And we are also building hand washing facilities and ramping up our community campaign at the moment. Next slide, Joe. So when it comes to utilizing the platforms, the non-contact methods, social, digital, mass media, non-contact methods, we have used a range of channels. It's because we want to expose people multiple times with repeated frequency with the intervention. So we have used radio, FM, the public announcement going into the village, mobile phones, the billboard, television advert. We're also making these television adverts more progressive because we started with the science video, for example, how virus transmit, then making more emotional hand washing with soap for the future, not only for disease, including social media for Instagram, Twitter, Facebook, print media, storytelling, cartoons, blog, and illustration. Range of, you can see the range of social media, mass media, and digital. All of these are non-contact methods because we are unable to conduct the actual community events when virus is still spreading. Since in few countries when viruses start kind of, the level of infection is low, then wearing a PPE kits and also maintaining physical distancing, we also started ramping up some of our existing community-based campaign. Next slide, Joe. So for behaviors, and three things need to happen together. One is we need to change the script in people's head. At the same time, through motivations, which is those mass media, digital media content. But at the same time, people need to have the facilities in place to enjoy, right? Hand washing facilities. So what we have decided as an organization, we really wanted to promote hands-free, contactless hand washing facilities in public places in order to reduce, in order for people to practice the behavior. So as you can see there, the paddle-operated hands-free hand washing facilities are installed in healthcare facilities, communities, slum area, marketplace, schools, and majority of them, those are inclusive to the different needs of the people. And our primary thinking was when we install facilities, let's install either permanent or semi-permanent structure, because we have seen, particularly on sanitation, the public toilets are not well maintained. At the same time, because people are not rushing now to build the hand washing facilities in public places, we don't want to be seen any hand washing facilities not having water and soap when it installs. So the sustainability aspects is quite fundamental. So therefore, we, since the beginning of the response, we are very precise and prescriptive for the sustainability aspects. And we have also developed the hand hygiene guide, and you can actually access using the link. Next slide, Joe. So together with the facilities, we have also put visual cues, nudges, and reminders, because the majority of the time people watch video, people watch television, CFM, but behavior need to be reminded in any specific locations where behavior happens. So therefore, we have created lots of nudges, reminders. As you can see, the branded mirrors with the visual illustration of the behavior, the clock, even the use of animals to distinguish how long is the 1 meter, 2 meter distancing, and so forth. Even, in slum and squatter area, people need to queue to collect the water. You can put the circle where people can actually queue. So positioning those actually useful for people to remind those behavior. My final slide, next slide, Joe. So what has been the learning based on our implementation of response in 32 countries, in 26 countries, particularly in 12 countries. One is, of course, the non-contact methods, hygiene promotion, behavior change promotion, particularly hand hygiene, need to be progressive. The package need to be progressive. Repeating the same media assets for several weeks actually saturates the campaign. So therefore, when you design the package, it needs to be in progressive. The government leadership is quite vital. It's easy to say that scale, implement nationwide campaign and so forth, but without government leadership, it's very difficult. So government leadership is quite vital for the scale implementation of any campaign. Use of multiple channels and touch points is key to reach the unreached population, because some people may not afford television, may not afford mobile. So how do you actually reach people who can't afford mobile television? So we need to find loudspeakers, maybe other methods to reach them. Public hand washing facility need to be inclusive and hands-free in order to minimize the cross-contamination. there was a high uptake in terms of hand washing demand and the soap demand due to the fear of coronavirus. Now, I mean, in countries we have a learning that is an opportunity to leverage other motives, because when the people are not dying, they will not see the COVID is there. So it's then an opportunity for us to build other motives like disgust, nurture, affiliation. And we have been using celebrities in terms of while designing the content, the television advert, the voice messaging and so forth. And this has been a huge good response from the participants. There are two key challenges. Of course, inadequate supply of water and lack of hygiene products has been a common challenge in many countries where we're operating it. Since we just started implementing it, sustainability of the overall response using non-contact methods yet to be measured. But I think the initial response, in terms of awareness rising and then reported behaviors, are quite high. Thank you, Alistair. Here, over to you.
Great, thanks, Sam. Yeah.
Next slide, Joe.
Thanks, Sam. All right, well, thank you. Again, I think the lessons learned were especially important. I think that they provide useful key takeaways from your work. The next couple of presentations will provide some key examples of available programmatic guidance and support. So first up, we have Lauren DeMello-Guillet, a research fellow at the London School of Hygiene and Tropical Medicine, and she'll be presenting on the COVID-19 Hygiene Hub. Over to you, Lauren.
Thanks, Aaron. Hi, everybody, and good morning or good afternoon, wherever you are. So I'm just going to talk about the COVID-19 Hygiene Hub today and link that to the current pandemic and the resources that are available to all of your organisations. Next slide, please. So the Hygiene Hub has three main functions. First is to produce and draw resource articles which draw on a wealth of up-to-date resources which synthesize the evidence and provide practical recommendations for your hygiene and COVID-19 response programs. Our second facet of the organisation is to have that real-time live technical advice. If you have questions about your programme, about your response, about how to get people to wash their hands, to physical distance and wear masks, for example, to get in touch with us. And lastly, to connect with others. So I'm just going to walk you through some of the examples that we've been working on at the Hygiene Hub and to really connect you to what's going on. Next slide, please. First, we have resource articles. We have 150 peer-reviewed resources across 18 different topics. These are available in English, French, Spanish, and Arabic. Examples of the different topics we're covering is, hygiene programs, of course, hand washing or distribution of hygiene kits. Also thinking about wash in schools or camps or different institutions. And lastly, big topics such as how to do community engagement at a distance, or how to design and develop information, education, communication materials that are for your local population. Other topics that are included within the Hygiene Hub are things such as gender and disability and inclusive programming, or use of masks. And what we do with these resource articles is that we collate the latest evidence into a digestible summary, pointing you to those original sources and really trying to get people to read through what's coming up recently. Just to let you know that these resources have been read more than 20,000 times since April 15, and 25% of our readership is in languages other than English. Next slide, please. Again, to highlight what technical advice we've been giving, we've had inquiries from 54 countries and 128 different organisations, so many of the organisations that are part of the SuSanA network, and we're either directing people to existing resources, helping them to connect with others, or providing that technical expert advice with relevant expertise for your programme. We can now boast of an 11-minute response time across all time zones 24/7. And again, 25% of our inquiries come in languages other than English. Next slide, please. Just to really highlight how we want to connect with others, and this is part of why we're showcasing what we're doing in the Hygiene Hub today, is that we really want you to share your projects with us. This helps you connect to local partners and other organisations in your area to see what they're doing, creating that shared learning space and really understanding what's going on. Next slide, please. And I just really want to highlight, and I will put a link in the chat box in a second, of case studies of different hand hygiene and COVID-19 response programs that we're collecting and collating each week. The photo on the left is an example from northern Syria, where they've added hygiene messages to the food and bread distribution that's ongoing with the IDP population there. Our example on the right I think many of you will know the classic tippy tap construction. So this is a case study where we have a group in Kenya who are kind of promoting, using their existing program to promote hand washing amongst their population. So I really implore you, and I want to plug this today, that we're really looking for more case studies from different countries and different areas. So please get in touch with us at the Hygiene Hub to share your examples. Next slide, please, Aaron. And lastly, oh, that's my thank you. That's me kind of done here. But I really want to kind of encourage you to share with us what you're doing with Hygiene Hub. Please do share your examples. Please do read the resources. Please do send us questions. If you have a question about your response program, especially about hand hygiene, especially about anything to do with wash, we really implore you to get in touch. Thank you very much.
Thanks, Lauren. Yeah, and I mean, I just like to reiterate the Hygiene Hub is a really great resource for implementers and those looking for resources on hand hygiene and all things COVID, really. Next up, we have Mr. Ron Clemmer with the Global Handwashing Partnership, and he'll be presenting on the partnership in the upcoming Handwashing Handbook. Off to you, Ron.
Well, good day to all of you. Great to be with you, and great to be able to share about the Global Handwashing Partnership and our forthcoming publication of the Handwashing Handbook. Next slide, please. So this slide just shares our partners, many of who are with us today in this session. And our partnership it is a public-private partnership. And so our partners include corporations and other businesses. It includes government entities, academic institutions, multilateral organizations, and non-governmental organizations. Next slide, please. The vision of the Global Handwashing Partnership is hand washing with soap and the use of hand hygiene products will be universally recognized, promoted, and practiced as fundamental to good health. Now, our activities fall into two pots. One is advocacy and one is as a knowledge hub. And our advocacy is to promote clean hands for all. And our knowledge hub, we're providing resources and learnings on hand washing and hand hygiene. And next slide. And so our major advocacy event is Global Handwashing Day, which is October 15th. The Global Handwashing Partnership is the founder for Global Handwashing Day, and we provide materials to support the celebration of the day, as well as providing a report of the celebration, which recently we had 600 million people celebrating Global Handwashing Day through receiving handwashing messages. This year's theme for Global Handwashing Day is hand hygiene for all. So we're amplifying the global initiative through Global Handwashing Day. And here's the infographic, which is our first support materials that have been published for Global Handwashing Day. And you notice that this year we're asking for commitments from each of our organizations of how we are going to accomplish hand hygiene for all. Next slide, please. And on the Knowledge Hub side, one of our important tools is the Global Handwashing Partnership website. And this is where we house resources, which you can see the tab in the middle that says resources. You can click there and then search on different hand washing topics. On the same row, there's a tab for Global Handwashing Day, where you will be directed to the Global Handwashing Day website, as well as a tab for the coronavirus outbreak. Next slide. And here's what our COVID page looks like. We have both resources and also a forum to discuss hand washing. Next slide, please. So one of the ways that we're celebrating Global Handwashing Day this year is through the publication of the Handwashing Handbook. And this brings the lessons and learnings of many of our partners. And so we're really excited to share that with everybody. The topics covered are making the case for hand washing, so talking about the health and other benefits of hand washing, and then designing and implementing hand washing programs. So getting into how the different steps of doing that and providing resources for getting into more details, especially the need for evidence basis for designing hand washing programs. To either look at formative research that has been done or conduct new formative research to see what the factors are that really influence whether people wash their hands appropriately or not. Another topic is promoting hand washing in specific contexts. So we need hand washing in our homes, we need hand washing in our schools, in healthcare facilities, at work, in the market, and other public settings. Also, we need hand washing to be promoted through integrated programming, not just through WASH, which many of us are in the WASH sector, but also in broader health sector, nutrition, early childhood development, and education. And then also an important part of the Handwashing Handbook is the chapter on addressing hand washing at a systems level, because we can do a lot to encourage hand washing through different campaigns and different contexts, but we really need a strong enabling environment to support hand washing. And that's what that systems chapter is all about. Now, the Handwashing Handbook will be available by Global Handwashing Day this year, and it will be available at our website, which you can see there. So we're looking forward to sharing that resource with you. Next slide, please. Okay, so again, we're looking forward to October 15th, Global Handwashing Day. Please go to the Global Handwashing Partnership website and then go to the Global Handwashing Day website for resources and tools. And please contact us with any questions. So thank you.
Great, thanks, Ron. Yeah, and I would like to again just reiterate, you know, Global Handwashing Day is coming up in October, and I think it'll be an important platform for us to raise awareness on hand washing, along with, you know, our continued hand washing advocacy. Next up, we have Dr. Bella Mons with GIZ, and she'll be presenting the Wash in Schools Network Guidance on Institutionalizing Hygiene Behaviors. Bella, off to you.
Thank you. Okay, hi. Can you hear me okay? Hello,
yes.
Can you? Okay, okay, thank you. Yes, first, thank you for the opportunity to present the Wash in Schools Network and briefly how we fit into this entire hand hygiene for all through Wash in Schools. Can you do the next slide, please? The Wash in Schools Network is an informal network. It's an interagency network of different organizations, practitioners, and the main goal is to harmonize the efforts of different development partners to support governments. So harmonizing and mainstreaming Wash in Schools. The network has been very active. It's existing since 2011, has been very active around 2015 when the different SDG targets and indicators for Wash in Schools were developed. So there was a lot of activity, and the network has also been very active in the last years to support the tracking of the SDG indicators and to share knowledge specifically during the international learning exchanges. They have been, it's a week-long meeting of government partners, development partners, an annual meeting since 2012. and a lot of mainstreaming has come through this sort of knowledge sharing. And there's as well very often discussions on Yammer and the SuSanA forum. In addition, I think there has been a lot of activity recently, of course, due to the pandemic. Next slide, please. Important to say is that the network consists of many, many organizations. We have several working groups, 6 working groups, but the main organizations or the lead organizations are, as you can see, GLAAS, Save the Children, UNICEF and WaterAid, but more organizations have been always participating and joining. Important now, I think the JMP report 2019 with data from 2019 was just launched 5 days ago on August 13. And shockingly, 57% of schools globally only provide access to water and soap, as we all know. It was also, this figure was also shown by Joe before. And interesting now to see this is the gap. And of course, we expect that COVID-19 has been a call to action to address this gap. And of course, we all expecting and anticipating that there will be rapid improvements because many, many countries have really done tremendous efforts to increase their hand washing facilities in schools. Specifically on hand washing, there has been lots of efforts. Next slide. And next slide, yes. The Wash in Schools network has specifically come up with WIN's action points, with 10 action points to preparing for the reopening of schools and specifically supporting schools at the school level, really not at the national level, but really at the school level, how to react and how to specifically manage the response to COVID-19. And the next slide or next top, you can see there has been specifically number 1 is really providing hand washing facilities. Make sure hand washing is really happening. This is the number 1 response. And I think the entire pandemic will for sure boost the investments in washing schools. Next slide. Yes. Important is hand washing really to observe physical distancing. And you can see here, if you have long pipes with outlets, there's a possibility to always leave out respective numbers so that the distance is observed, and that there's also the possibility to place signs on the ground, on the floor, as also mentioned, or which is much supported and featured by the Hygiene Hub and their publication on nudges, because nudges can also support these observance of physical distancing. Next slide. Yeah, important is you can see here a checklist. The global network has worked on concrete checklists to guide actions on school ground and facilities hand washing prior to school, that children enter school. So prior to entering of schools, checklists are there so that kids will wash hands, and there's somebody who checks that this is done and that that the water is available, and that really school communities are guided to proper manage the daily hand washing and the hand washing activities in schools. And I stop here and thank you for your attention.
Thank you, Bella. It's great to see so many tools and resources, especially as schools come back into session. Last but not least, we have Mr. Carlos Carrion Crespo. He's a sectoral specialist for public services and utilities at the International Labor Organization. Carlos, off to you.
Can you hear me?
Yes, we can hear you.
Okay, good. Thank you. And good morning, everybody. Yesterday, I had the sad occasion to say goodbye to a colleague who died in Lima from this tragic disease, COVID-19. And the message that I had to say to our colleagues when I was speaking on behalf of the staff union, was that we should honor our dead by fighting for our living. And this is the message that I want to start with. When we talk about hand hygiene in the workplace, we're talking about one of the places where the outbreaks of the virus have been coming up more recently. It's the workplace, particularly where migrants work, informal workers, and others who cannot keep social distancing. And this is where hand hygiene is particularly important. You can go to the next, before you go to the next slide, So you can see that picture. The first thing about that is that the ILO is the UN's only tripartite organization, which means that it's not composed only of governments, because employers and workers together hold 50% of the votes in our governing body and in our annual conference. This is why you see those three keys. It's not just about the language. It's also because the original gate to the first building, which is the one that houses the World Trade Organization right now, could only be opened with all three keys. And each key was held by the governments, the workers, and the employers' organizations. With this in mind, we can go to the next slide. We have, in the ILO in 2001, we issued what we call the hierarchy of controls, which means what are the measures that need to be taken in order to safeguard the safety and health of workers in order of priority. Because in the case of COVID-19, we do not have the first priority available to us, which is to prevent the disease from actually occurring, to eliminate the hazard in OSH speak. Then we have to recur to other measures of control. And one of them is the administrative controls. And among them is hand washing. Now, hand washing has historically been a concern in industry, and collective agreements have included measures for its promotion, both before and during the pandemic. We have the examples of the collective agreement for the meat industry in Spain, for the collective agreement for the maritime sector from 2018, the collective agreement for hairdressing and beauty services in Belgium in 2013, in Colombia, the biosecurity protocol that was created for the pandemic on 25 March 2020. All those have been agreed by the employers and the workers, and sometimes together with the governments. These agreements commit employers to providing washing facilities and to encourage and ensure sufficient time for their use. And these are the two most important elements that we need to pay attention to when it comes to workplaces. Not only should we have the facilities, workers should be able to have the time and the facilities to use them. Now, many unions are also providing advice on hand washing, on information sheets, and have even cited the lack of facilities or the lack of time for hand washing as reasons for striking or for refusing to return to work. Most famously, lately, the American Federation of Teachers was considering strike action to protect its members against the COVID. So we have issued, we are about to issue a policy brief from the ILO on hand hygiene in the workplace, and this is the title. It has the same title that this presentation has, and we do cite the Hand Hygiene for All Global Initiative, and this policy brief is meant to be a contribution. Now, other actions that the governments have taken are really widespread. We have seen that water operators in Bangladesh, Eswatini, Guinea, Honduras, Madagascar, Nigeria, Pakistan, and Peru have taken measures to facilitate and promote hand washing. Nigeria has established a wash sector COVID-19 response committee, which has leveraged support from the private sector. In Malawi, the government and the social partners, meaning employers and workers, organizations, have issued together guidelines requiring employers to provide hand washing facilities for their workers. And then the European Commission on 11 June decided that COVID-19 was an occupational hazard, and therefore the directive that deals with these occupational hazards was activated, including hand washing facilities. We have a program called the Employment Intensive Investment Program that supports water and sanitation infrastructure in several countries, including Jordan and the Philippines. But it also has launched a COVID-related initiative in South Africa that has hired 20,000 young people to help with the distribution of hand sanitizers and soap, provide education and hygiene prevention measures. So this is the case in Nicaragua, in Indonesia, in Bangladesh, etc. Now, when it comes to ILO conventions, we are going to see the list in the next slide, but not yet. What's important here is that each one of these conventions that you are going to see is the product of years of negotiation between employers, workers, and governments, and only adopted when 2/3 of the votes, including all three groups, are in favor. So it takes years, but at the end, each one of these conventions counts with the blessing of the governments and the employers as well. So these are not just employee favorable recommendations and conventions. So you can go to the next slide, and with this, I will wrap up. You can see the different conventions and recommendations that link to this. We have the Safety and Health in Agricultural Convention, the Plantations Convention, Safety and Health in Construction, Hygiene in Commerce and Offices, in Dock Work, and the Maritime Labor Convention. But there's more. If you look at our website, you will find codes of practice on occupational safety and health. Each one of those codes of practice contains measures about hygiene and particular attention to hand washing. Those include forestry, include ports, include oil industry, it includes even shipbreaking. So those, you'll see that for each convention, for each sector, we have paid particular attention to the safety and health of workers, and that has always included hygiene and hand washing measures, preventing the different illnesses that are related to the occupations. Thank you very much. With that, I will give the floor back.
Great, thank you, Carlos, and thank you to all the presenters. I think that provides a really great overview of all the efforts around hand hygiene, and I think it also helps set the scene for some of the discussions that we'll have to come. We do have a couple of questions. Maybe we can just take a couple of minutes to answer those quickly before we move on. So the first question that I'm seeing, perhaps Joe, you can take it on. The question is there existing agreements made by countries to achieve targets set in SDG 6 with accompanying promised funds to achieve said targets and goals?
Aaron, thanks. Is the question in the chat? Because I probably need to, or if you could repeat it.
Sure. So it's in the Q&A feature, and the question is, are there any existing agreements made by countries to achieve targets set in SDG 6 with accompanying promised funds to achieve said targets and goals?
Thank you, Vicky, for that question. I don't believe that there is that level of agreement yet at the country level, and certainly it is very country specific. So perhaps if you would like to take the conversation offline and to talk specifically about the country that you work in, that's possibly the best approach for that. Or perhaps you could provide some more information on specifically what you would like to learn about. Beyond, obviously, the SDG framework itself.
Yeah, great. She has a follow-up questions for programs implemented by organizations. Do you only directly work with or through governments, or can you involve entities and schools directly for some projects or activities? Again, it's in the Q&A feature.
Yeah, absolutely. Thank you. No, I mean, as I hoped to reflect in my slide, though I acknowledge that I'd run out of time slightly, I'll just pull it up now, is that we really want to ensure, of course, that we're drawing from the expertise and the energy and the resources and the activities that are being carried out in this space by the broad swathe of supporting stakeholders that have worked on hand hygiene for several years or that have a renewed interest in it since the outbreak of COVID-19. And absolutely, we're not working directly only through governments, but we really want to hear from you to join this initiative. And so I will leave my contact details in the chat function, but also the Global Handwashing Partnership that you heard from Ron Clemmer about in this meeting is a core partner of the Hand Hygiene for All initiative, and will be able to really ensure that we have that reach across supporting stakeholders to communicate and to solicit information and expertise from you.
Yeah, definitely. And I think that also kind of goes along with a question that I saw in the chat as well. Ron, maybe you can speak on this a little bit, but how can civil society organizations partner with the Hand Washing Partnership?
Thanks, Erin. So civil society organizations can be partners, become partners with the Global Handwashing Partnership. Just go to our website and you can see how you can become a partner, or just contact Erin or myself. So that's the way you can become an official partner. Of course, you can also sign up for our mailing list and you'll receive our monthly newsletter. And the other thing is just go to our website and you have the resources available for you there. So there's several different ways that civil society organizations can take advantage of the resources of the Global Handwashing Partnership or actually become a partner. Thank you.
Great. And then I did see a question in the chat again. How are washing COVID-19 interventions linked? Maybe you could take this question on. I also saw another question asking if there's any special focus in your programming on personal hygiene awareness and plans in India. So maybe you could take both of those on.
Thank you very much. Yeah, thank you for the good questions. I think, first of all, we need to look at the transmission route for COVID-19. Of course, it's a droplet. It can transmit from the infected person droplets. It's a respiratory disease. So that means when those droplets are either in hands or in the surface, the people, if they are not maintaining the personal hygienes, the people can be infected. Obviously, they are close to them, droplets can actually transmit to the disease. So if you look at the evidence from WHO and from the ongoing evidence globally, there is no direct link to conclude that this can be transmitted through either feces or into the contaminated water yet. There are some kind of growing evidence. It's still new disease, lots of information coming in. However, without wash, maintaining personal hygiene and maintaining the adherence of the behaviors is quite impossible. So WAS has a direct link in order to reduce the infection as well as to reduce the transmission of this virus. I think from the behavior change point of view, when it comes to WAS, water, sanitation, and hygiene, of course, if not having water in any specific locations, you can't just wash your hands. Not having sanitation facilities in proper place where there are the people you are putting in quarantines, it will compromise the quality of the care and so forth. I mean, in a way, WAS has a direct link with COVID-19, and I would say this is a fundamental and essential ingredients to cope with and also to reduce the virus, to suppress the virus in a way. In terms of, I think the other questions about the promotional aspects, I can't see that is specific. Can you repeat that question, Irene?
Sure.
India
so
question.
there was a question just on, is there any specific focus on personal hygiene awareness and plans in India?
Oh yeah, okay, great question. So I mean, if this is specific to what we have launched the hygiene behavior change campaign in early March and April. It was quite a focused intervention in 8 different languages in India. It was a national campaign. We have reached around 8 million population through that initiative. So currently our Indian office is actually responding particularly focusing on hygiene behavior change and other ongoing WAS intervention in specific locations. When it comes to hygiene, we are still primarily utilizing the non-contact methods, heavily mobilizing local FMs, the radio, and then also the loudspeakers going into the village, and also building some facilities in specific locations, particularly in schools and healthcare facilities. And the promotional aspects into the village within our existing programming is actually limited at the moment. Going to house visits, it's quite difficult at the moment because that might transmit the disease. But there are some initiatives going on in order to virtually link with the communities, and also kind of a small scale promotion in a small gathering while still maintaining physical distancing and wearing a mask. So yeah, some initiatives going on. I'll be happy to link you up with our India colleagues if you have any specifics interested in 5 specific locations.
Great, thanks, Sam. Oh, thanks, Sam. And I see that we have quite a few questions coming in, but for the sake of time and to continue moving this session forward, we will be collecting the questions, and we can send a document with the answers to the rest of the questions, along with the recording link and the summary of the presentations. But we do want to move forward. We do have a very interactive thematic discussion to come. And so with that, I'd like to pass it back over to to lead those thematic discussions. Over to you,
Thank you very much. Thank you all the presenter and the questions from the participants. It was an interactive session. Thank you very much. Joe, can we move to the next slide? So in order to structure our focused thematic discussion, so we have outlined, we can actually discuss in 4 thematic areas. These thematic areas are choose based on the current evidence and also the interest in the sector. I mean, within water, sanitation, and hygiene, hygiene has always been an add-on activity in many of the programs before COVID-19 scenario. Due to fear of COVID, now everybody is jumping and rushing to build the hand washing facilities and trying to buy the soap. At the initial phase of the response, you might have seen this. But when it comes to hygiene, actually, especially the behavior change, hygiene, though it has always been an add-on activity. One of the questions that we are always putting ourselves, how can we implement hygiene at scale? So with COVID-19, I think the things are quite evident now. Without large scale design and implementation of hygiene behavior change program, either at district level or at regional level or at national level, now with COVID-19, designing and hygiene intervention at the global level is also equally important. So hygiene scale implementation is quite vital. I mean, we have implemented, many organizations have implemented projectized fashion in specific locations. But in order to change the behavior without mobilizing a large scale population to create a social desire and norms, the sustainability of those behavior is always a question. So therefore, one of the thematic area that we would like to discuss today is hand hygiene at scale, particularly how do you actually design, implement nationwide, district-wide, or global hygiene behavior change intervention. That will also include how can we actually influence national government or donor for scale initiatives, and also funding a large scale campaigns. The second one, second thematic topic is the hygiene integration. Hygiene doesn't fit in one institutions. So hygiene does have a multiple mode or channel through which we can integrate through different ongoing platforms. So it's not only the responsibility of Ministry of Health or only the responsibility of Ministry of Water. So hygiene can be actually integrated with different platforms within the existing programming, such as in health, we can integrate hygiene into child health, immunization, nutrition, cholera programming. Similarly, in education with the school WAS, the previous presentation, also in livelihood, in collaboration with private sector. The integration aspects is quite key. And there are very limited evidence, I think, currently when it comes to hygiene, how can we integrate hygiene into the existing programming rather than implementing in a vertical way. So the integration, hygiene integration is one of the key areas where we would like to have a thematic discussion today. The third areas of work is in order to facilitate the behavior change, the technology is quite important. And the approach that we use for hygiene behavior change is quite important. It has to be innovative because traditional approach of telling people to this and that using posters, pamphlets, leaflets, and wasting lots of money on printing caps and t-shirts is not going to change anyone's behavior. We know that in this particular forum, I think I don't need to even repeat this. So how can we bring innovation in our approach? How can we make sure that we work with very marginalized, specific need groups people so that we can get the right output? At the same time, also actually build hand washing facilities that are inclusive, that are user-friendly, the cost-effective and sustainable. So the innovation around approach and the technology is another area that we like to have the thematic discussion. Finally, once you implement your program, definitely the effectiveness of your program has to be documented. At the same time, we also need to understand how and how and why the program has been successful so that we can actually replicate those programs. This can be done with the various monitoring initiatives. For hygiene behavior change, we can start with the formative research, then we can also set up a baseline, inline through our outcome measurement. At the same time, process documentation is quite vital in order to learn the lessons and share the learning across different institutions. So what we'd like to do now, in these 4 key areas of work, scale implementation, integration, innovation, and monitoring, we would like to hear from the participants, especially this session is actually for you. So we'd like to hear from you. Do you have any experience of any of these? And also, do you have any ideas, or do you have any questions specifically to any of these 4 thematic areas where you would like to see? If you have any specific examples you like to put into the chat box, if you have any specific questions you like to also put into the specific questions. At the same time, I mean, since we have only 20 minutes to wrap up the whole session, I think we can probably go maybe 5 minutes each max, so that we can start with one specific thematic focus discussion. So you can start now thinking while we discuss one thematic area. You can start putting your question into the question bank, into the Q&A chat box. At the same time, if you want to share some of your learnings, you can put into the chat box. Also, you can also unmute your microphone and ask the question or share your learning. If you are sharing your learnings, you'll have 1 minute to wrap up very lightly, or you can put into the chat box. So with that note, can we start with hand hygiene integration? If anyone has any question on it. I mean, we have feature also that is part of the Washington School initiatives. There are other examples from health, hygiene integration, hand hygiene integration into health as well. So can we start from there? Anyone would like to have any questions, any learning would like to share? Is basically up to you, all the colleagues into this call. So okay, so I can't see any question so far. You might still thinking how can you best structure your question and so forth. With that note, because we have very limited timing, can I invite Bella, would you be able to come in, and if you have any specifics to tell in addition to what you have presented from Wynn's group on the integration side?
Yeah, perhaps. Thank you for giving that opportunity. Yes, I think under the aspect of hand hygiene integration, the integration of hand washing into routines in school is coming up in many countries now, really developing routines and institutionalizing them within the education sector. So really making hand washing part of your day. At the moment with COVID, it's coming up that more and more countries, even in Germany, they have hand hygiene, hand washing facilities, entering school entrance, and kids wash hands before they enter the building. And I think this is, for example, and it's a good example for integrating it into the education sector. And I would love to take up this question of somebody coming from India mentioning the Swachh Bharat initiative and saying, well, we build a lot of toilets, but they're not properly used. It's totally clear it's not about the infrastructure. I think that is so important. And I think mentioned that as well. It's not the infrastructure. It's really the behavior. And that means the institutionalizing and integrating it into the activities. And it's not, infrastructure is needed, yes, but it's not the only thing. Different parts have to get together.
Great, thank you, thank you, Bella, for this one, and also on the because Bella has focused mostly on the school, and then few examples from integrating hygiene into the health programming. So we have experience of working with the Ministry of Health in Nepal. We have integrated hygiene into existing immunization program. It was in a pilot phase. We started in 4 districts, worked together with the Ministry of Health and USAID and others. It started in 4 pilot districts, and the program was designed through a robust mechanism. It was more innovative and creative. When mothers visit the vaccination clinic, they will be exposed with the hygiene intervention. The government has then decided, subsequently looking at the results, because results was quite exciting, and they have decided to scale up these initiatives nationwide. And just in May, after the COVID-19, the government has now launched that initiative, integrating hygiene into vaccination program, the routine vaccination program nationwide. They have recently trained more than 16,000 health workers. Now they are targeting this intervention to 650,000 mothers attending an immunization clinic, and they will be exposed with the hygiene intervention, hand hygiene intervention, including that behavior is also promoted. So then also we have seen hygiene has been integrated into cholera vaccination program. Hygiene also integrated into the nutrition program in very many countries. So there is a potential for integration. The integration can actually help to maximize the benefit. At the same time, it has seen as a sustainable model to deliver, because you have the existing platforms. You just need to build the capacity, and then making sure that you then have the package to deliver it through the existing mechanism. And actually strengthen both the programming through your existing health or education programming, at the same time the behavior change programming. So since I haven't seen any other questions on the integration, if you have anything specific, please do write it here. I have seen one, the CLTS. Yes, hand hygiene integration into the CLTS is one of the key areas of work. Please do share if you have any specifics, because CLTS is primarily focused on sanitation. So, I mean, people might defecate into the toilet, but without washing their hands. If we don't have hand washing facility closer to the toilet, it's not going to be beneficial from the public health point of view. Yes, CLTS does require inclusion of hand hygiene. We're glad that you have featured these. Right. If there are no specifics on the integration, can we move to the next one, which might be hygiene innovations and technology? Anyone has any questions on hygiene innovation and technology? Innovation in terms of approach, and the technology in terms of hand washing facilities or products, or any other innovation? Good. Okay. So since colleagues are still typing it while we monitor the questions, I would like to invite Ron. Ron, do you have any specific examples that you have come across in terms of innovation and technology?
Yeah, one of the innovations, I think, is just in hand washing stations and having products for that. You know, tippy taps have been used widely, and you know, there's been some success with the use of tippy taps to support hand washing, but there's also quite a few failures in that area because tippy taps don't always work very well. So I think, you know, there's been some innovation of groups that have been able to sort out the tippy tap issue. There's been a lot of cases where that has not been sorted out, but you know, folks are turning to a variety of different products for hand washing stations. So I think that's one of the areas where we really need more innovation, is in hand washing stations, and how to make that where you can wash your hands in a safe way, because not all of the hand washing stations allow you to wash your hands and necessarily keep your hands clean. So that's definitely one area of innovation that we need further work on.
That's great. Thanks, Ron. Yeah, so I think there are a couple of other questions into the chat box we can try to address, but as much as we can, because this is primarily focusing on these 4 thematic areas. If those are linked, we can address. Otherwise, we'll definitely touch base with you. Yeah, on the innovation, technological innovation side, and then also the approach innovation. As you can see, I think the whole world is shifting from more knowledge-focused intervention to more on behavior change-focused intervention when it comes to hand hygiene, because we have seen there are lots of assessment has been done, rapid assessment after this COVID-19. Majority of the people in many countries where the research has been done, they are aware that they should be washing their hands, but the problem is they are not doing it. The adherence level is quite low, and at the same time, the availability of water and soap is also quite critical, and that is lacking in many cases. And the recent examples and data from WHO, UNICEF, and washing skill also demonstrate the same. So we are bringing that innovative approach, working with the creative team, maybe working with the private sector institution who can actually do the marketing, working with creatives, we can demonstrate, they illustrate the key nudges, reminders in terms of approach, and making sure that hand washing technologies are inclusive, available. Ron, you mentioned about the tippy tap. We have seen the people has built tippy tap immediately after cholera outbreak or Ebola outbreak. And those, I mean, after Ebola was declared, there is no more cases in DRC and so forth. Those built tippy taps actually not in existence after the crisis is over. So therefore, it is important that when we promote it, we should promote more on sustainable manner, primarily focusing on maybe the facilities in public places, maybe permanent, semi-permanent facilities, and so forth. So if you have any specifics to share on these 2 topics that we have covered so far on the integration and innovation, you can raise your hands as well. So if you have any specifics, or you can, you can just type it and then ask you would like to share any experience, or you have any, you have used any innovation, you can do that. So there is one specific question to you, Joe. Would you like to come in and address while the colleagues will be still thinking? So the question is around, I think it's from the top on DAS. Can there be a global campaign with the initiative of WHO to have coordinated campaign linking with the Handwashing Day?
Thanks, and just to flag as well, I think there are a few people on the call who would like to speak, who've put their hand up in the chat. But perhaps I'll just respond to that. I think, without wanting to pass the buck, I think actually the best people to discuss Global Handwashing Day and plans for that are our colleagues Aaron and Ron from the Global Handwashing Partnership, who are on the call and who are a core partner of the Hand Hygiene for All initiative. But really just to say that absolutely there are lots of plans afoot for this, and we are rapidly approaching, we have 2 months now to Global Handwashing Day, as you know, and we are organizing around common ideas and common materials, some of which Ron has already shared. But I wonder if I could hand that question over to Ron and Aaron to provide a bit more detail in that regard.
Thanks, Joe. Yes, I mean, October 15th is coming quickly, and I shared the infographic with the main theme of Global Handwashing Day this year, Hand Hygiene for All. We will have other support materials coming out very soon. Our task forces are working on that, and we'll be publishing more materials here in the next week or two. So to find those, go to the Global Handwashing Partnership website, and then you can just link to the Global Handwashing Day website from there and find all of those support materials. Thank you.
Great, thank you, Rob. So while monitoring the chat box, particularly on the technological innovation, yes, thanks Mimi for sharing the handwashing compendium from ideas. It was, I think, well received by different organizations, and thanks for putting all that compendium together. We have seen the UNICEF has produced the same. We have seen Waterford has also produced the same. Definitely, those are good resources to look the different design and the sustainability aspects of those facilities. Great. And then also there is a question from Oxfam. Yes, Oxfam, it's part of the Defeat Unilever Behavior Change Coalition initiatives. So you have mentioned that you have lots of promotional materials developed using other magic hands and so forth. Thanks for also sharing the link. So there are lots of resources already available. So let's reinvent the wheel. I think Mother Magic Hands, if you like to very quickly turn on your microphone and 1 minute, tell us about the Mother Magic Hands. Foy? Okay, if not the case, I think we have the link. We can also browse the materials related to Mother Magic Hands, developed by Oxfam together with Unilever. There is another nudge around the food operated hand washing facilities are actually useful in many countries, which is nice. Yes, we have seen in order to reduce the cross contamination when people are washing their hands, those are good. The sustainability aspect of those, yeah. And then also I think there is a question of the proper disposal of the gray water. This is one of the key areas, I think, when we are installing hand washing facilities in public places and so forth. How do you actually manage the gray water? There is specifics. I think is in Hygiene Hub. How do you actually manage the gray water? At the same time, I think there are some resources already developed in terms of how water can be provided, the refill, and the washed water, how it can be disposed properly. Otherwise, it can be recontaminating either the source of water or to the environment if we transit that into the environment. School hand washing facilities compendium also developed by GIZ and UNICEF. So in terms of technological option, I think we have lots of evidence. Joe, I can't see any hands, unfortunately, from my screen. So can we move to the next one? Yeah, because we have like 7 minutes. So if you see any hands, someone raise, you can definitely.
Onyala and Rory have had their hands up for a little while. So just two.
Oh, sure. So, Ollie, you would like to come in? Oyala? All right. Okay, if that's the case, can we move to the hand hygiene at scale? If anyone has any experience of implementing large-scale behavior campaign either at national scale or regional scales or at global scales, of course. Yes. I think in the chat box, there were a few questions, a few initiatives around CLTS. CLTS has been implemented in many countries at national fashion, as well as it has been implemented at global fashion, which is very nice. I have mentioned one examples in Nepal, which is integration, but at national scale. There is one in Pakistan. It was jointly implemented by Ministry of Climate Change together with UNICEF and Waterford. It was a clean campaign, and now it's a clean green initiatives. This is also the COVID-19 hygiene specific intervention also featuring there. Defeat Unilever has also put 200 million initiative together as part of the Behavior Change Coalition initiatives and funded many organizations to implement large scale campaigns in many countries as well. So these are some of the latest recent large scale campaign. And to be opportunistic in Waterford, we are also implementing very large scale campaign in 12 countries, as I mentioned in my presentation as well. So those will be available when it comes to sharing learnings through the different organizations' website and so forth. So still monitoring. Anyone would like to come into the hygiene at scale initiatives? I don't know why I can't see any hands in my screen. If anyone still have any questions, Tapandas?
I think the hands have come
Okay.
down.
Sure.
There was a challenge with unmuting, so if people do have a contribution to make, we're aware of that now. Tapandas
Sure.
is requesting to speak, so I can see if I can unmute. There we go.
Sure.
I think I've unmuted Tapandas now.
Tapandas, can you hear us?
I can't seem to. You might have to try and do it yourself.
Sure. Sure.
In the participants list. And also Rory is keen to talk.
Hello.
Hello.
Yes,
Hi. Hello.
Hi,
Are
it's
you hearing
Rory.
me? Are you hearing me?
Yes.
Yes,
we
yes,
can
I can
hear
hear
you
you.
loud
we
and
can hear
clear.
you.
Good.
Yeah, actually, the proposal that I have mooted is, for having the hand washing in scale is to involve all governments across the world by the the international organization like WHO or UNICEF, so that unless the government takes the ownership initiative, it cannot be in the scale. So can there be an agreed, now there are 2 months about time we have there, but then we involve all the governments to agree for a joint initiative, at least on the day of the hand washing, and for almost 7 days, so that a behavior is established. Can it be done? I think I propose this. Thank you very much.
That's great. I think, yeah, this might go to Ron and team. I think from my point of view, what I would like to sum up for this one, of course, Global Handwashing Day is an advocacy day. It's a partnership between different institutions, including the government. Anyone implementing at country level should definitely have the government in the government leadership, definitely bring the government on board. Under the government leadership, let's celebrate together. It's not the day that we would definitely like to see happening again and again. It's a kind of whole 1 year or 2 years celebration of the hand hygiene initiative at this scale. But I think your point is quite well noted. Definitely, we still have 2 months. So how can we bring more government on board with the hand hygiene hand hygiene for all initiative, global initiative from WHO UNICEF? And of course, that initiative also urges the government to develop the country roadmap. And I mean, developing country roadmap, I will see an opportunity for us to work together with the government for the scale implementation. So for the sake of timing, I think we should definitely move on. I think Tapandas, the question is exactly the same. So, yeah, Bella,
sorry, just to underpin, I like very much the comment, the previous comment of, I didn't hear the name of one of the participants, fantastic, to really, we always speak about scale up, but NGOs can never do a scale up. Development partners can never do a scale up. WHO, UNICEF, nobody can scale up. Only the government can scale up. We can model, we can have showcases and so on, but the real scale up can only be done by the government. Therefore, we can only also model or support with thanks the government is able to scale up. So I think that is something so important for all of us to keep in mind, to keep interventions that low level, low possibility that the government is able to pick it up, to scale it up, and that it is within the absorptive capacity and financial capacity of the government. I think that is something,
exactly.
I'm very happy for that input. Thank you so much for that.
Thanks, Bella, for raising this. Absolutely critical. I think pilots are successful. Scale up are failed in many cases. It's because I think there is no fundamental right institution to deliver it. At the same time, I mean, as you are rightly pointed out, I think neither of these development partners has the platforms to implement at this scale without government leadership. And then where we have seen the nationwide scale up happen, I think under the government leadership happened either in Nepal or in Pakistan or in Nigeria at this scale, and other countries. Absolutely critical and fundamental. Thanks for raising this. And finally, I think we need, we should be definitely closing in few minutes. Can we touch base on the hand hygiene monitoring? So because we haven't touched that specifically, I haven't seen any specific question around hand hygiene monitoring, but I just would like to give 1 minute to Lauren. Would you like to come in and highlight the importance of it and what is specific that we think might be feasible to do during COVID-19 scenarios? Lauren, over to you.
Thanks, and thanks for the questions so far. So this topic is really kind of posed to the audience to think about. How can you be monitoring your hand washing and hygiene programming, well, both during COVID and otherwise? And so it's really thinking through those kind of quantitative and qualitative indicators that you can be kind of conducting within your programs. You know, we've talked a little bit about formative research, understanding your population, understanding the kind of motives for their behaviour, but that can be conducted at multiple times throughout your program. Other things such as kind of looking at the outcomes of your program. Are you having both the expected behaviour change? Are you having any expected changes on other social outcomes, or any changes on health outcomes? Something we always forget to mention as well is a third option is that, fair enough, you may not be able to look at the outcomes of your program on health or social indicators, but you could look at the process of delivery. And this is something that's been really important during COVID-19. You know, we're not necessarily going to be able to attribute reduction in transmission to our programs, but we can look at those process indicators. How was your program delivered? Kind of what was the reach of that? Who were you including in that program? You know, are you including those who are most vulnerable? Are you including those with disabilities or those of different genders? So it's really thinking through the way that you can kind of use different indicators to both quantify and qualitatively explain your programs. But we'll be happy to open up the discussion now to you all to think about what indicators you are looking at or what you would like validated for your hygiene programs. Thanks.
Thanks, Lauren. Thanks very much. I think colleagues can still chat and put their thoughts into the chat box. Since we are coming towards the end of the program, I would like to sort of, you know, sum up the thematic discussion areas that we have covered. Of course, these 4 key areas of work, these are fundamental areas where we should definitely thinking. So when we start positioning hand hygiene, we should be thinking, how can we implement it at scale in the leadership of the government, working with multiple partners, not in vertical fashion, but in very coordinated fashion at scale. Without scale implementation, I think meeting 2030 vision is not possible. That's key. The second one is there are multiple ongoing programming happening in health, education, nutrition, schools. So how can we tap those opportunities to leverage those platforms so that hygiene can be integrated in order to maximize the benefit for behavior change as well as for the ongoing programming. The innovations and the technology are quite vital, because without innovations, the program can be fatigued and the people not be changing behaviors over a long time. Innovation are needed. At the same time, the behavior change products and technological options are needed. I mean, there are lots of innovations already happening around this. Thanks for sharing all the links. We'll be putting all of these into the meeting minutes and share. And then finally, on the monitoring, as Lauren mentioned, I think without measurement, it's very difficult to say whether we are working or we are effective in terms of changing the behaviors of the people over time. And it's not only changing the behavior of the people, but also changing the behavior of the donors as well as the government from the behavior change initiatives globally. With that note, I would really like to thank all the presenters and also participants for your participations, for your questions, and really sorry for changing the platform from Adobe Connect to the Zoom, and also not having proper time to fully discuss because of the logistical issues. I think we would have imagined these happening very frequently. And what I'd like to promise from the SuSanA Behavior Change group is we'll be having learning series from October onwards in every month. So they we'll be inviting many other institutions to participate in this series to share their institutional learning in coming months. At that particular point of time, with thanks to everyone, participants and the presenter, I'd like to invite Joe. Joe, do you have anything to say from WSU UNICEF?
No, nothing to add. Just to add my thanks to the pile. It's been a really interesting discussion, and it's wonderful to see such a lot of contributions from you all in the chat. I think the challenge with online platforms is that we can't always have the floor to share to speak, but we will be collating all of the information that you've shared here, and also following up with a number of you where we think it might be possible to capture some learnings and case studies to share more widely as well. So please watch this space. But just a big thank you from me and from the other panelists for your time today.
Thanks, Zoe. Thank you everyone for joining, and we'll be definitely sharing the recordings. We'll have the meeting manuals as well as presentation to all the presenters from the SuSanA Behavior Change Group. Thank you everyone for your contribution.
Thanks, everyone.
Thanks. Thank you also. Thank you.
Thank you, everyone.
Bye-bye.
Thanks, everyone.
Thanks. Bye-bye.
Nice seeing you.